All right, we're going to focus on health news this morning. And this is interesting. I didn't realize that. Did you know that 1 in 5 Americans suffer from acid reflux? Well, we are welcoming back, it's been too long, but Dr. Ross from AdventHealth to talk more about this. Good morning, Dr. Ross. How are you?
Good morning. Very good. Very good. Staying healthy.
Yes, we're all trying to, right? That's the motto of 2020.
Right.
And this is something we haven't really talked a lot about this year, because obviously there's been some other health factors that have taken center stage. But this is just as important because so many Americans, so many people are suffering from this.
That's right. That's right. Gastroesophageal reflux disease is more common than people realize. And we all go to treat what we think is very useful, which is with medications. However, it does not remove the risk of chronic acid reflux. And therefore, we are here seeing more evidence of an incidence of esophageal adenocarcinoma of the esophagus.
All right, so let's talk about chronic and what makes it chronic. I mean, how often are people, generally struggling with this? How do you know when it's become a problem and it's just not an occasional thing?
Yes, well, if by definition, many people suffer from reflux, but by definition, if you have 2 or more episodes of reflux in 1 week, then you should be looking into evaluation, whether whether it's considered significant acid reflux and therefore needs to do something about it. Now, the risk of this chronic acid reflux, and sometimes you don't even feel heartburn, yet you have the reflux and the exposure of the lining of the esophagus to acid. If it's chronically happening, there are changes in the lining of the esophagus that can lead to cancer. And that's what we can stop, and medications alone do not stop. So it has become a real problem in our community.
So are you seeing more of that? Because I actually have a friend of mine who's young, by the way. I mean, this is not just a certain age thing. I feel like we're seeing this of people of all ages.
Absolutely. I would say one of the risk or the predisposition is obesity. And it has become an epidemic in the U.S. And the more obesity you see, the more likely patients are to suffer from reflux. So it can attack any age group. And some kids or even babies that are born with hiatal hernia and such and suffer from severe heartburn and regurgitation. And so that is definitely more common than people realize, and majority of the patients are treated just with medical therapy.
I was just going to ask about treatment, and I want to make sure that you talk about those symptoms and what it actually feels like, because I wonder if sometimes people don't realize, oh, wait a minute, that's what that is, acid reflux.
That's right. I mean, when you have symptoms of heartburn and regurgitation, and you find yourself taking more and more or requiring more and more medications, that's when you need to start to figure out, is this really a problem or not? Go to your primary physician and ask them to be seen and be evaluated by a gastroenterologist. There's objective studies that we have out there that can determine whether you have significant acid reflux. And so EGD, which is the scope that the gastroenterologist will introduce to the esophagus into the esophagus and stomach, and see if there are any changes in the lining of the esophagus. But more than that, they can place a chip at about 6 centimeters from the end of the esophagus, beginning of the stomach, that will objectively, over 48 hours, will determine whether you have significant acid reflux, where if you do, you will benefit from a procedure that will stop the acid reflux, and you no longer need medications to relieve the symptoms. So that is very important, that people need to know about that.
Absolutely. And I'd imagine diet has to be a big part of this too. I know there's certain trigger foods that people just need to make sure they stay away from.
Exactly. And people learn because they just listen to their body. And so they know if they avoid alcohol, avoid chocolate, avoid coffee, spicy food, all of those things, or tomato sauce that cause them the symptoms, they avoid them. But more than that, it's important to, when you talk about diet, is eating small amounts throughout the day, not eating a heavy meal for dinner and then going to lay down and expect not to have some symptoms. But after you do all of those modifications to your lifestyle and weight loss, most important, if you still suffer from reflux and all those modifications did not work, you're still requiring medications, I would definitely suggest to be evaluated for acid reflux with a Bravo pH off any anti-acid medications that will determine whether it is a problem that needs to be fixed, or you can just live with it because it's not threatening your risk of esophageal cancer.
Yeah. Well, doctor, thank you so much for spending some time with us. So glad to be able to check in with you. Stay safe and healthy yourself. Of course, there's the website where people can find out more. But again, thank you so much, doctor.
Thank you very much.